Right now, we're on our way to see one of my palliative patients, Riley, who has several genetic disorders that cause GI and respiratory problems. Our hospice and palliative programs are community-based, meaning that we care for them in their home setting, so we go to them. Children we care for have many different illnesses, including birth defects, genetic disorders. With palliative care, it's for chronically ill patients, and we focus on providing relief of their pain, symptoms, and emotional distress, and they can also seek curative treatment. Our goal in palliative care is to improve their quality of life, not just of the children, but also of their families.
Pertaining to my son, I was very nervous. I didn't really want to think that. I didn't really want to go there in my head because nobody really wants to think that their child is that sick. But he's not. He's just Riley. He's just my child. He has his challenges, and we needed more help than what we were getting. A lot of it's just support, just having the support and knowing that there are people with answers to the questions that we have. We also have gotten supportive services from Dr. Putnam. He's come out to see Riley a few times. We haven't needed quite as much of that lately, thankfully.
Almost all of the patient interactions I have are on home visits now, and it's really a wonderful advantage to understand who the person is, who the family is, what their culture is, what their memories are from pictures on the wall.
Riley sees specialists at 2 different children's hospitals, and sometimes the specialists don't talk to each other. So one part of the palliative program that's really helped is getting somebody to be a go-between and get everybody on the same page. It's definitely improved his quality of life. When we first started with palliative care, his GI team at the time, they were really out of ideas for him, and they didn't have any good answers for us. And we were able to get connected with a different GI team at a different hospital that had better ideas, and since then his GI has been more stable, he's a lot more comfortable, and he has many fewer bouts of pain.
My first visit with Riley, his mom expressed that at night he was feeding the bed, and it turned out that meant he was unhooking the liquid nutrition that was coming into his stomach and letting it drip into the bed because his stomach was getting filled up and full and starting to hurt and cramp. Mom questioning, what can we do to help him not suffer in this way? And my response was to say, well, we need to try cutting back on the amount of nutrition that he's getting, which means cutting back the calories and what his dietitian felt he needed to grow normally, but making that decision in order to be kind to him so he wasn't suffering so much.
I always have questions about the insurance, but we get help from a social worker who we can call any day of the week we need him. Now I have more tools. I have more support. I know I can call and ask for help with just about anything I need. Social work has done a lot as far as helping us, providing linkages to different agencies and programs that we weren't aware of that have helped us with finances and to services and benefits that are available for him, which really has helped out quite a lot. We didn't know anything like that was out here in this area before a palliative program came in to help us. And as far as the medical, any question that I have about Riley, I can always direct to the nurse. And there's a lot of questions. With so many of his body systems affected, I call usually at least once a week with a question about something.
An easier path of communication, instead of the constant calling a doctor for something that, the nursing system is there, that infrastructure is already there, so.
I know a lot of people will think that palliative care means that we're not trying to fix what's broken or wrong, but that's just not the case with Riley. If there is a cure out there, I know that we could still pursue that and get the palliative services we get now.
Jessica and Riley illustrate how much people suffer from medical uncertainty, diagnostic uncertainty. what does the future hold and how is my life going to change. What Jessica would like to know is what exactly does Riley have, and she wanted him to get down to the undiagnosed illness clinic at the NIH where his genome could be studied, and he might, and this is in process now, he might fit in with a genetic diagnosis that actually has a name and there are other people like him. And what Jessica would really like from that is to understand what's going to happen to my son and what's it going to look like in the next few years, and how is that going to affect me? How can I plan for that? So having really no diagnosis and no idea, she struggled with trying to understand the future.
You know, the care that he does get, you know, with the nurses and the palliative program, you know, is a relief. You know, it's
Yeah, that's how
it lets you know that you don't have to be, you know.
I'm not a one-man show anymore. It's really helpful to have some more people involved that know this journey and that have seen this journey before, and then can point us in the right direction and help us make the best choices.
That's me, Hannah.
It's allowed us to have more free time to do family things without compromising Riley's care.
People often are, like Jessica, doing a wonderful job with their decisions and their care at home, but they wonder, am I really doing all that I should? Am I doing an adequate job? Am I making the right decision here? So for a team to go in and help people understand, yeah, you're doing a great job, and we see what you're doing. And to let them know this is what could happen next, and we're going to prepare you for that, and we're going to help you through it.
I don't know how to say it. I want to just tell people, don't be afraid of the stigma. Don't be afraid to call, because it's not about how sick your kid is. It's about how good things can be. It's about getting help to make things better.